Hi, it's Mark from TLR. I'm here with Simon Kelly. He's a physiotherapist at Insync Physio in Vancouver. They are multiple time best physios in Vancouver, award winners as voted by their customers. And Simon's going to talk about leg nerve irritation. What is this all about, Simon?
Hi, Mark. How's it going? Thanks for having me again. I'm just going to talk a little bit about leg nerve irritation. And, a lot of times it's hard to pinpoint where the irritation is actually coming from. But most of the time, it's actually coming from the lower back region, somewhere between L1 down to L5 vertebrae. A lot of times, people get quite worried that it can be something quite serious like a disc irritation or a disc compression and things like that. And on occasion, it actually is those things. But a very, very small percentage of people actually need to go for surgery. So it's good to be not too scared in the beginning, but of course it's good to get checked by a physiotherapist as well. The other thing just to bring to mind just for some people as well is when the nerve is already irritated as it comes out in the lower spinal column, it kind of brings down the threshold of the nerve. So we've all heard of sciatic nerve pain, but it's things that are usually not painful, like sitting, can then become painful. So I kind of use the analogy, it's like water coming out of a hose, and then you step on the hose and the water stays coming out. It doesn't really affect it that much, but then you step on it in another location, irritated in the nerve root and then irritated from sitting. And it's the sitting then can drive the threshold down. And that's when people really come into us reporting lots of tingling, numbness, and irritation referring down the leg. We call it double crush syndrome, which actually sounds pretty scary, actually. But a lot of the time it can be really fixed.
So if I was experiencing this, I might not necessarily be feeling pain in my lower back, but I might feel it in my legs. Is that why we're kind of referring to leg nerve irritation?
Yeah, absolutely, Mark. Yeah, like it doesn't always have to be linked with a major nerve, like traumatic back injury. Sometimes it can just be progressive in nature. And, as we get older, we get stenosis. That's like a narrowing in the spine and the lower back as well. Lower population or lower age population people, usually it's not like a stenosis or degeneration and things like that. But from my experience, 99% of the time, once you kind of eliminate the inflammation at the primary source, whether it's the lower back or sometimes as it passes through the bum muscle, aka the sciatica, it will eventually go away. That's where we come in then in the clinic, and it's all about the education of what movement somebody can do. And if you can fix the back pain, but if you don't tell someone not to sit for long periods of time on a hard surface, that's going to keep irritating that nerve and it's going to be ongoing for quite a long time.
So how do you treat it?
So that's it. Yeah. First of all, when the client comes in, we do need to figure out, first of all, where it's coming from if we can. Either the back, usually it is the back, or usually as it passes down through the bum muscle. And sometimes it is two areas. So we have to treat both. So in clinic, we do a lot of hands-on treatment. We do a lot of needling in the lower back just to kind of decrease. It's kind of like the hypertonicity of the muscles. So the muscles get really tight around the nerve. And this is a common mistake that a lot of people make is, oh, the muscle must be tight, let's stretch it. But stretching in this occasion, it's not really, the muscle is tight because the nerve is sending a signal to the muscle to protect it. In other words, please leave me alone. But what people do then is they kind of throw petrol on the fire and by stretching it. And that really, really irritates the nerve. So a lot of the stuff we do is actually a nerve flossing or nerve glides, we call them. You're actually gliding the nerve. So you're not actually stretching it. You're actually just moving the nerve as one unit by different movements in the clinic. I can't really show you on the video here now, but that helps desensitize the nerve. And once the nerve becomes desensitized, it stops sending a signal to the muscle and the muscle relaxes and it's not in spasm, preventing you from moving or causing pain essentially. So by eliminating inflammation around the nerve, obviously you can do ice and a bit of rest for that too. And by doing these nerve flights, especially in the earlier stages of rehab, you can eliminate all that spasm that a lot of people complain about.
And is that why you use the needling? Is that also help with the relaxation of the nerve?
It kind of helps more so the muscles around it, Mark, to be honest. So the muscles, it does help relax the muscle around it, but the primary objective would be to get that nerve moving normally without irritating by fully stretching it. Or we all like that feeling of a nice stretch, but in this particular occasion, that's really, really really bad to do. But you're right, yeah. The muscle spasm, the needles just help release that to give someone a bit more mobility in their back, again, in the earlier stages. Once that's all settled, and we have certain tests in clinic we use to kind of see what the nerve mobility is like, we can obviously go back into strengthening it, a lot of core work, a lot of lower back stability stuff. And obviously, depending on what the client does, back to running or higher end plyometric stuff.
So what's a typical treatment protocol like this? What does it normally take for somebody to get back to doing some of that stuff? Of course, it's individual, but what would be the typical time
Yeah,
frame?
absolutely, Mark. It is very individual depending on the person's circumstances, but you're probably looking at maybe 8 to 10 weeks, like kind of from start to finish. And obviously, take that with a grain of salt, depending on the population and different ages and different activities. But yeah, 8 to 10 weeks, depending on the irritability and also depending on when we kind of catch it, how limited and how what kind of was the mechanism of injury as well may also have to be taken into account for sure. Was it traumatic or was it more gradual, for example? Traumatic can sometimes take a little bit longer.
So what's the common cause of this kind of leg irritation, referring from the back?
Yeah, one of the common causes, just lots of excessive sitting, even Mark, especially if it comes on gradually in nature, like we're all, especially in this pandemic or in general, sitting for long periods of time, sitting on hard surfaces. If you kind of think about it, like older people get a lot of pressure sores because they can't really move their body in bed when they get very, very old. It's kind of a bit like that. I mean, at an extreme level, obviously somebody can move a little bit in the younger population, but you're kind of depriving the nerve of sort of nutrients through blood flow as well. And eventually it hits a certain threshold where it gives you that signal of maybe tingling down the leg, where it's like, wow, you really need to get the pressure off this nerve as it's passing through the bone muscle. There's obviously more traumatic stuff as well. If you had a fall off a ladder and you injured your lower back, for sure, that obviously you'd have to go for x-rays to make sure you had no fractures or anything like more serious. But once all that's been cleared, it's a matter of really just getting rid of the inflammation. The treatment is not very different. It might take a bit longer though in the traumatic situation.
So if you've got tingling in your legs, if you've got pain that you suspect might be from your back, but it's in your legs, in your sciatica, get in to see Simon Kelly at Insync Physio. You can book online at insyncphysio.com, or you can give him a call, 604-566-9716 to book your appointment. You have to call and book ahead. He's busy, but he'll get you feeling better as fast as possible. Thanks, Simon.
Cheers, Mark. Thank you.